We've done hundreds and hundreds of cases now completely successfully with a combination of local anaesthesia and sedation. In fact, I cannot remember the last time we did a facelift under general anaesthesia. It must be at least 5 years ago. With the general anaesthetic, the patient is totally unconscious. With sedation, the patient remains semi-conscious. So it's a halfway state, if you like, between unconsciousness and full consciousness. And of course the level of that is completely variable using modern techniques. Nowadays we really give patients a choice of how deeply they want to be sedated, and if you're more anxious, clearly you're going to need or want more sedation. You're going to want to be more out of it, as it were. The pre-operative visit is obviously very important, so I can go through the process, explain what's going to happen to them precisely, and they'll have a chance to answer questions. One of the great advantages of having sedation for a procedure rather than general anaesthetic is the starvation period. You really only need to starve, that is, not eat anything, for a couple of hours before having sedation. So we advise our patients to have a light breakfast 2 hours before they come for their procedure. You tend to feel much better both during and after the procedure if you have sedation. Certainly the recovery profile is much better with sedation than general anaesthesia, and I quite often get asked, will I feel sick after having sedation? And actually the answer is no. So the way we tend to play it is we make the patient very sleepy for the first few minutes while we inject the local anaesthetic, and then we lighten the level of sedation to a level at which usually they can talk to us. Patients often remark at how comforting the presence of the nurses is, what confidence they have in us as a team, and something as simple and human really as just somebody holding your hand through a procedure is incredibly powerful for some people. For our patients, one of the spin-off benefits of having treatment under sedation rather than general anaesthesia is that we can carry out the surgery in a minor ops theatre, and the hospital fee is therefore significantly lower. The difference between the cost of an operation under general anaesthesia versus sedation can often amount to £2,000 or £3,000. So you can save a very significant sum of money by having your treatment under sedation rather than a general anaesthetic.